And welcome back. Next on our show, we have with us Assistant Medical Director Dr. Yitz Goldstein and Director Sheila Reynoso at Montefiore Medical Center to tell us about how pathologists and clinicians are working together to diagnose, treat, and prevent hepatitis. Welcome to you both. Thank you for being here.
Thank you so much for having us.
So tell me first about World Hepatitis Day.
So just so we make sure that all of viewers are on the same page, hepatitis is a disease of the liver. The word literally means a liver inflammation, and it has a number of causes. It could be caused by excessive alcohol consumption, it could be caused by a number of different drugs, and it can be caused by viruses. Viruses in particular are a major concern because they can lead to a chronic infection, which can cause damage to the liver long term, which can lead to liver scarring, what we call cirrhosis, and can ultimately also lead to cancer and death. In an attempt to raise awareness about the infectious nature of the viral hepatitis, World Hepatitis Day was created to really educate the population about hepatitis.
Yeah, and so World Hepatitis Day is an opportunity for us to raise awareness of what both hepatitis B and hepatitis C is. And it's really a global concern because there's more than 300 million affected with both of these diseases. And what's even more shocking is that the majority of individuals don't know that they have hepatitis B and or C. It's really a silent epidemic, and so it's an opportunity for us to discuss and how to strengthen our efforts in making sure that we're preventing both hepatitis B and C, that we're screening, and then also that we're providing treatment. And so fortunately for these diseases, hepatitis C, there is a treatment and a cure, and then for hepatitis B, there is a vaccine and treatment to limit disease progression.
So are there symptoms, I know you said it's kind of a silent killer, but are there any symptoms that folks should be looking for?
Sure. So there are a number of symptoms associated with hepatitis infections. They include nausea, vomiting. Sometimes there's a yellowing of the skin, which we call jaundice. There can be changes in bowel habits or urine habits. But as Sheila mentioned, often people don't realize that this is associated with a viral hepatitis. And what's important also is that people realize that there are various groups of individuals that are at higher risk. So individuals that use it or have used intravenous drugs, individuals that received any form of blood product before the early 90s, and really anyone that was born between the years of 1945 and 1965. About 3/4, 75% of cases of hepatitis C come from that group of individuals. And so there is a big drive to get all individuals born between those years to be tested for hepatitis C.
Did you want to add something? No? Okay. So you're saying that for hepatitis C, there is now a cure for it. I shared with you before we came on that my grandmother had hepatitis C, and I always thought it was something, she wasn't a drinker or anything like that. You always think that some of, that these diseases are associated with some type of lifestyle. So tell me a little bit about that, the cure, and what we're doing now to deal with that.
Sure. So it's important to realize that exposure to any form of infected blood can lead to a hepatitis infection. And so it doesn't have to be necessarily a lifestyle that we associate with receiving those infections. It could be something as simple as sharing a shaving razor that could have some blood on it. Tattoo parlors are a major source of infections that we like to keep track of to prevent the spread of these infections. And so it's important that people realize that it's not just those types of behaviors that we typically associate with infections, but that a broader range of really anyone that received a blood product before the 90s, the blood supply at that time wasn't routinely being screened. And so there's a risk that they could have been infected with the virus. And so it's important that we test individuals so that we find these infections, limit the spread, we treat these individuals, and now that we have a cure, that we cure these individuals. And that's really why we're here today.
And just the difference between Hep B and C.
Sure. So they both cause liver damage. Hepatitis B One of the major differences that patients should be aware of is that people that are at risk for hepatitis B, there's actually a vaccine for hepatitis B. So healthcare workers that may be exposed to blood products or blood in some way, individuals that do have high-risk behaviors that want to limit their risk of hepatitis B can be vaccinated to prevent the disease. Hepatitis C does not have a vaccine, which is one of the real reasons we want to make sure that individuals get tested to identify their status. They know that we can then go on to treat those patients and cure those patients.
And remind us, when is World Hepatitis Day?
It is on July 28th.
July 28th. Are there any upcoming events right now that Montefiore Hospital Medical Center will be hosting for World Hep Day?
So Montefiore Hospital recently hosted a research symposium in New York City from researchers around the world presenting their cutting edge research regarding hepatitis B and C in an attempt to further the research environment to ensure that everyone has equitable access to care. One of the things that people don't realize in the Bronx possibly is that while we may not have more cases than some of the other boroughs, we have the highest rate of death associated with cirrhosis and liver cancer, greater than any other borough in New York City. And so Montefiore is continually trying to provide optimized testing strategies. In my laboratory, the Virology Laboratories, we take a single blood sample. We then provide all necessary testing for the physician to be able to begin treatment at the next visit. So we don't want to have a situation where patients come in for a screening test, have to come back for a confirmatory test, and then need additional testing to know what specific type of hepatitis the patient has in order for the physician to treat. So we take one sample, we go through an entire algorithm designed with our clinician partners to be able to ensure that from testing to the very next visit, we are providing optimal care and ready for therapy. And the next step after we have a positive test is our essential programs that Montefiore runs in linking those patients to care. So while we may not have the highest numbers, if you think about, well, why do we have the greatest burden of death associated with the disease? It's because somehow we're not linking these patients to therapy, to care. And that's where Sheila's work really is essential.
Yeah.
How can patients get in touch if they wanted to get tested, if they wanted more information?
Yes, so we do have a phone number. It's 1-844-CURE-HCV. And so individuals can call that number and, ask to get tested, or even if they are aware of their status, get linked to care.
All right, 1-844-CURE-HCV.
You got it.
We have to take a quick break, but we'll be right back with more Open.